Okay, so I'm going to show you an example of a rheumatoid nodule here. So you can see a central area of a mix between eosinophilic material and some amphiphilic, purplish, even basophilic material. And that's all surrounded by a palisading histiocytic population. So the best way to figure out if you're dealing with histiocytes is to think, are they neutrophils? No. Are they lymphocytes? No. Are they, eosinophils? Are they any other cell type that you might think? No. So your first instinct, if you see somewhat oval to round shaped nuclei with abundant clear cell cytoplasm, think about histiocytes. And this pattern of histiocytes surrounding this necrobiotic area here is good for a rheumatoid nodule in the proper clinical context. You can see different patterns to the way that the palisading is occurring. It's not always perfectly oval or circular. Sometimes you get these little boomerang shape or moon shaped areas. Again, it all depends on how the section was cut and what orientation, but you'll get these several collections depending on how big the nodule is. So just palisading population after palisading population. Now, the other important differential diagnosis for this pattern would be a deep granuloma annulare, but the clinical scenarios are different. So this would be in a rheumatoid arthritis patient. You'd be expecting a rheumatoid nodule. In young kids, you can have deep subcutaneous nodules like in the feet, and you would be considering a deep granuloma annulare at that point. I often have found in the cases of rheumatoid nodules that there is some more amphiphilic or basophilic looking material intermixed with the eosinophilic necrobiotic collagen more often than in the cases I've seen with deep granuloma annulare, but I wouldn't use that as a definitive criteria. I think that grossly, this is probably much bigger than you're going to normally have in a deep granuloma annulare, but again, that's not definitive as well. So hopefully you get some clinical information, or they don't put both of those on the answer choices and you can just choose. Now, I wouldn't choose a superficial granuloma annulare here. Also, in terms of other palisading entities, we don't have any epidermis in this tissue for reference, but I wouldn't consider a necrobiosis lipoidica here because you can't really look at the cake layering architecture here. You can't appreciate that, and you would want to see at least an overlying ulceration or an epidermis to help orient you to that. So they wouldn't give you this for a necrobiosis lipoidica. So the best answer in this case would be a rheumatoid nodule. It's important to remember that there are case reports of epithelioid sarcomas that have presented and looked like a rheumatoid nodule. So if you see a pattern like this, you want to zoom in to the peripheral palisading histiocytes and just make sure that they don't look like a malignant cell type. If you were concerned, you might do some keratin stains. You might do a CD68 stain to prove that they're histiocytes. You might do a keratin stain to make sure that it's not some type of keratin-derived tumor related to an epidermal cell of origin. You might do an INI1 if you did find some cells that you thought looked atypical, because if you have preserved INI1, that argues against epithelioid sarcoma, because most epithelioid sarcomas actually lose INI1 in the nuclear compartment. So those are just things to think about on the differential, but this is a rheumatoid nodule.